Hello and welcome to Hospital Noise and Sleep Disruption. My name is David Woodruff. I'm the president of Ed for Nurses, where we empower nurses to be extraordinary. This is part of our 2-minute EBP challenge. Every Friday we send out a question, comes right to your email inbox, and then every Monday we send out the response to that question so that you can stay up to date with evidence-based practice. If you'd like to get your own copy to your email inbox, just go to edfornurses.com and you can sign up right there on the homepage. You can also find us on Facebook. Go to facebook.com/edfornurses or just search for Ed for Nurses on Facebook. This week, what we're talking about is hospital noise and what kind of effect it has on our patient, and then what we can do to try to limit the amount of hospital noise and how much it's going to disrupt our patient's sleep. So first of all, let's talk a little bit about what hospital noise is doing to our patients. It's causing cardiovascular stress, and in fact, in the current study, they found there was a significant increase in patients' heart rate when noises were applied. Secondly, hospital noise causes impaired immune response, so it decreases the patient's immune response as a result of stress. Next, stress in general, because we're disrupting sleep, we're disrupting the normal circadian rhythm, that 24-hour rhythm that the patient's body has, is going to cause stress in general. They're like the release of cortisol and those kind of things, the stress response. Lastly, is that will also lead to depression. We need to have a good sleep cycle in order to work through some of these things that we're going through psychologically and physically in order to have physical recovery and psychological recovery. Some of the effects of sleep deprivation are listed on this slide here. And again, some of the things we already talked about. You see all the cognitive kind of pieces there and the behavioral problems that will occur if patients have severe sleep deprivation. Impaired immune response, risk for type 2 diabetes, increased heart rate variability, and the risk for cardiovascular disease, decreased reaction time, maybe even tremors and aches. Other types of problems could include growth suppression in children, the risk of obesity, or decreased temperature. So all sorts of problems can occur from having sleep deprivation. Now, what this chart here is showing is a typical sleep cycle, assuming somebody goes to bed at midnight, wakes up about 6:30 in the morning. And what it's showing is the different levels of sleep, the stages of sleep. So we go down through these different stages here. Now, the REM sleep is listed up here at the top. Now, the way that this is dividing the stages of sleep out is by brainwave activity. So during REM sleep, we have more brainwave activity, but the patient isn't necessarily easier to arouse, and we'll talk about that in a moment. So start out with awakening. As we move down through the depression and brainwave activity, we go through stage 1 sleep to stage 2 to stage 3 to stage 4. Stage 4 sleep is a pretty deep type of sleep that your patient's going to have. So if we start out at the top there with stage 1 sleep and kind of work our way through, in stage 1 is kind of the beginning of the sleep cycle. It's relatively light. This is just kind of you just kind of dozing off here at this point in time. Stage 2, we're starting to get into a little bit deeper sleep. This stage 2 lasts about 20 minutes, and the patient may have some kind of sporadic brain activity at this point in time. Stage 3, now we're starting to get into a little bit deeper phase of sleep. And then stage 4 lasts for approximately about 30 minutes. Sleepwalking is most common to happen here, and bedwetting, things like that, because the brain really slows down in stage 4. It has what's called these delta waves, or the really slow waveforms that occur. Now, in order to get into our REM sleep, our stage 5 sleep, what we have to do is actually come back up through stage 3 and stage 2. So the patient has to come back up, and you see that kind of illustrated here in the diagram. The first time, it just kind of jumps up into a very short REM sleep. Then the second time kind of moves back up through the stages a little bit better into a longer period of REM sleep, and then longer and longer. Now, REM sleep tends to increase as the night goes on. So if our patient only were to sleep 2 hours, maybe they get that little short burst of REM sleep, but they wouldn't get a whole lot of extra REM. And you see, because we need to sleep for a longer period of time for that REM sleep to start increasing. So why is that important? Because REM sleep is important for physiologic and psychologic recovery in our patient. So we do need to be making sure that our patient gets that REM sleep. So if our patient's just kind of dozing on and off, they're never really getting into the deep levels of sleep and into REM sleep where they're going to get the real physiologic help. So we want to try and control the noises that are going to be present around our patient so that our patient hopefully can have the best level of sleep and really be able to recover well. So what kind of noise is worse? Well, in this particular study, they found that electronic noises are the worst ones. Our IV pumps that are beeping, our pulse ox alarms, or our EKG alarms that are alarming, those kind of things are the worst noise for the patient, probably because we're not used to those kind of noise. Background noises like doors closing and things like that are a little bit more disturbing because they're sudden. So that's kind of more disturbing to our patient. However, voices were the least disturbing of the noises. Certainly, they can arouse the patient and wake the patient up, but they were the least of the three types of noises, probably because we're more used to having people talk in the background as we sleep. Not necessarily that that's happening all the time, but voices were not as objectionable to people while they were sleeping as other types of noise were. So what can we do to try to avoid interruptions of our patient while our patient's sleeping so our patient can hopefully recover better in the hospital? First thing we can try to do is decrease the amount of noise, understanding that the electronic noises are going to be the worst. So let's try to get those toned down a little bit to help our patient. Vital signs. Now, you need to do assessments on your patients, so don't get me wrong here. I'm not saying don't do vital signs, don't do assessments. I'm just saying maybe we can think about organizing these things together. Typically, most of the time now, we have other people doing our vital signs, and we're not doing them any longer. If we have a patient who really is sleep deprived and needs some extra sleep, we may need to organize those activities together and do our vital signs at the same time we're doing our assessments. Our labs, lab comes in at 4 o'clock in the morning, wakes the patient up, and then sticks a sharp needle into them just to make sure they're wide awake. So, that's another thing, too, we have to be aware of. If we know lab is coming in at 4 a.m. or 5 a.m., and that's how it's just got to be, then let's try to plan quiet time for our patient so they can have a significant period of quiet time and get into that REM sleep. Lastly is visits. Visits from physicians, visits from us, from physical therapy, occupational therapy, and everybody that comes in to see your patient. Try to limit the visits. And again, I'm not suggesting that we decrease the amount of assessment we're doing, just maybe that we do it in different ways so that we're not interrupting patients' sleep all night long. Certainly, you don't want this to be the message that your patient gets. Try to get some rest. I'll be in every few minutes to make sure you don't. Okay? We don't want our patients to be in that kind of situation. Now, if you'd like to find out more about this study, you can get the article from the Annals of Internal Medicine, and it's available online now ahead of print by using the link that's shown on the screen. Thanks for joining me this week for Hospital Noise and Sleep Disruption. My name is David Woodruff, the president of Ed4Nurses, where we empower nurses to be extraordinary. Join us online by going to www.ed4nurses.com. Thanks for joining me this week, and until next time, bye now.